for taking time out of your afternoon to join us today for an overview of Common Ground's 2021 small group EPO plan offerings. A few housekeeping items. We'd appreciate if everybody would mute their mics on their computers during the presentation. There is a chat box available on this webinar, so if you have any questions as we go through the slides, please feel free to ask those questions and we will address them at the end. Also, at the end of the presentation, we will open up the mics so that if anybody has any live, more complex questions that they want to ask, please feel free to do so. And the other thing I'll note is that today we had a presentation of this last Wednesday, and today is the final presentation for the introduction of the 2021 small group plan offerings. So afterwards, we will be sending everyone a copy of this PowerPoint presentation deck, along with an additional appendix with some more detail on the plans and some of the more detail, obviously, and also a pretty lengthy Q&A addendum that will answer a lot of the questions, general questions that you may have or any of your associates in your office may have. So, I'm going to start off the presentation for all, and we're going to stay on time for you. Then about halfway through, April Schultz is going to pick it up and finish off. So with that, we're going to talk a little bit about what's coming from an agenda standpoint. So we're going to touch on who we are, Common Ground as an organization, talk about the fresh approach to the direction we're taking in the small group market. We're going to touch on some of the plans and provide you a general overview of them. Talk about our service area and the great EPO network that we do have. We'll touch on the coverage and benefits, the plans that will be available to employers and their employees. We'll also review the general eligibility guidelines and quoting, and follow up with Common Ground Group and broker support so that you can contact us if you have any questions or quote requests. So first of all, our mission, Common Ground's mission, and I'm sure many of you have heard this before, maybe this is the first time you've heard it, but our mission is putting members first, pursuing better health care. And Common Ground is kind of unique as an organization in that we are a healthcare cooperative. And so our setup is a little unique from other insurance companies out there in the marketplace. So we're a nonprofit. We're operated for the mutual benefit of our members. So any things that we make, they're returned to our members in the form of lower prices and improved services. So a couple of examples of some of the things that we've been able to do because of our organizational structure is, when the COVID-19 pandemic hit, one of the things that we had concerns about was for existing small groups and the impact that the pandemic was having on employers was the affordability of maintaining their group health insurance with Common Ground. So early this year in May, for the monthly premium on small groups, we reduced the premium amount that they owed by 50%. And we're following that up again in September and October of 2020 in response to the COVID-19 impact. So for groups that are with us in 2020, it'll be 3 months out of this year that their monthly premiums are going to be reduced by 50%. So that's been very well received by the accounts and also by the brokers that have these accounts with clients. And as a company, we're very pleased that we have the flexibility and capability to do that on behalf of members. The other thing we have been able to do is in 2019, we generated medical loss ratio rebate checks. So based on our claims experience and the fact that we're a very well-run organization, we're actually below the 80% threshold requirement for insurance companies to pay out premiums from a claim standpoint. So anything under that 80%, we return that money back to our members in the form of rebate checks. So for any member that had a policy with us in 2018, whether it was for 1 month or whether it was for the entire year in 2018, they received a rebate check based upon a certain percentage of the premium that they had paid in toward their coverage. And I'm pleased to announce that we're going to be doing that again here in 2020, and that will be based upon a 2019 experience. So again, two just very great examples of because of the way that we are set up as an organization, as a nonprofit and member-driven and member focused, that we're able to provide these services and benefits to our members. The other thing that's really unique about Common Ground is that obviously we have an executive team like any other insurance company, but we also have a board, and they're critical in helping set the direction of the company and helping and working with the executive team and partnering with them to make major decisions on the direction of where Common Ground goes. And one of the unique things about the board of directors is that those board members, they are members of Common Ground, either individual members or they are small business owners. They definitely have some involvement in the organization, as well as health insurance coverage for themselves or for their company and their employees. So we are member governed, and obviously we're made up of thousands of members and businesses and families in the state of Wisconsin purchasing individual and group health insurance. So we're going to take a look at the fresh approach, the new direction that we're taking in the small group market. So we took a look at the small group market, and there's a lot of jostling going on, a lot of things that are changing, and we talked with a lot of brokers and businesses, and the transitional plans are starting to decline, and we have a very successful individual market story to tell, and that market is stabilized, and it's really taught us a lot about service and pricing and maintaining a portfolio that an offering that is very appealing to individuals and to small groups. So what we're going to be doing is really taking that individual ACA experience, and we're going to transfer that into our small group platform. We obviously already have small group plans, but we're going to re-energize that platform and grow considerably in the ACA group market. So one of the major things that we're doing on the small group side is we're moving from a PPO platform to an EPO platform. So by doing this, we're going to be realizing significant savings, anywhere from 13 to 20% on comparable plans that are available from Common Ground now. So we feel that this new plan portfolio is going to be very, very competitive against any other plan offerings out there, whether they're self-funded or fully insured plans. That's going to take effect on January 1st of 2020, January 1st of 2021. So we have a very high level of service that we provide to our brokers and members, and obviously that's going to continue on the group side as it is on the individual side. And we're going to touch on the excellent provider network that we are offering as part of our small group EPO platform. So I mentioned that we're going to be having EPO plans. So we use an Envision Integrated Health Network, and the EPO plans basically means that the small groups will be set up on EPO plans, and eligible services will have to be provided in network. Okay, so it's the exact same setup that we have on the individual ACA plans, and that's going to transfer over to the small groups with January 1, 2021 effective dates. So by doing this, we're going to be able to, as I said before, offer significantly lower premiums on a monthly basis. And we hope that for many groups, it's going to allow them to continue to maintain group health insurance coverage for their employees as a benefit. And for others, maybe allow them for the first time to have something that's affordable and offer it as a benefit to not only keep, but to induce employees to come and work for that organization. So the new platform is going to be effective on January 1st of 2021. And so for all new business that's quoted with a January 1, 2021 effective date, the new EPO group platform will apply. Any existing groups that are in force here in 2020, as they're renewing in the 2021 calendar year, the offering that they'll have on their renewal are the EPO Envision small group products from Common Ground. So currently for their small group platform, we offer 8 different plans, from silver to bronze to gold. They meet a lot of needs for a lot of companies and employees. And one of the things we're going to be doing in 2020 is we're going to be significantly expanding that offering. So we're going to go from 8 plans currently to 19 in-service area plans. And obviously those are for employees that reside within the service area of Common Ground. And we're also going to offer 6 out-of-service area plans, and those will be available for employees that live outside of the service area for Common Ground. So, you know, as we see the employment trends and employment trending, you know, we see more employers possibly bringing in satellite employees or remote employees that may not be working in the service area. They may be working out of state. So this is going to be a nice way to accommodate those individuals with plans that are specifically set up for out-of-service area employees. So as I mentioned before, we're moving from a PPO platform to an EPO platform. And a lot of what we're doing as far as shoring up the small group product portfolio at Common Ground is going to be guided by the success we've had on the individual plans. And as I mentioned before, going to this new format is going to significantly reduce the rates, again, from about 13 to 20%. So I think for a lot of employers, they're going to be very pleased with the rates. I think you as a broker, I think you're going to have an exceptionally competitive product offering that you can show to not only existing clients, but potential group clients when it comes to bringing Common Ground into the mix. So obviously we're backed by an excellent service team, not only from the sales and marketing standpoint, also from the customer service standpoint and claim standpoint at Common Ground. And currently, Common Ground is the largest ACA health insurance carrier in the state of Wisconsin. So we've been very successful. We know what we're doing. We do it very well, and we're going to leverage that and significantly grow the small group health insurance platform with a new EPO product offering. And the other thing that's nice about Common Ground is that we're locally based. We're based in the metro Milwaukee area, so all our operations actually run out of the Brookfield, Wisconsin office. And I think a lot of employers and businesses, and I think you as a broker, I would hope really appreciate the fact that you've got a local company that's here to help and support you and to help you grow your practice. So one of the things we're doing in 2021 is we're expanding our service area. So if you look at the service area map, currently here in 2020, we service 20 counties, and they are noted in orange on the map. Kind of runs along the east coast of Wisconsin from Marinette in the north down through Kenosha. We are adding 2 counties in 2021. So we're adding Green Lake and we're adding Florence. And so Green Lake and Florence, they are noted in blue on the map. So obviously Florence is a little bit west of Fond du Lac. And when you get up north, Florence is going to be north of Marinette. So every year, the management team and the board, they kind of take a look at, you know, the service area that Common Ground is currently involved in. They evaluate whether it is wise from a resource and a competitive standpoint to expand into other areas. So in 2020, we did not have any expansions, but here in 2021, we're moving into 2 new territories. So for some of you, hopefully, that's going to significantly improve the a number of clients and prospects that you can touch base with regarding Common Group's small group health insurance plans. So let's talk a little bit about the EPO network. We have a very, very strong EPO network. So some of the significant health insurance partners in the network are Aurora Healthcare, Bellin Health, Theta Care. There's Doak County Medical Center and clinics. There's also Children's Hospital, and they have locations both in the Appleton-Nita area. We also have St. Joseph Hospital, and that's the Milwaukee campus only. It's kind of a one-off for us. They're affiliated with Ascension, and we basically brought St. Joseph in to better serve the local Milwaukee area community. We had a lot of requests to do so, and so St. Joe's was brought in 2020. New for 2021 and primarily servicing the Florence County area, Dickinson County Healthcare System. So a very strong lineup of providers that are in the Envision Integrated Healthcare System. So as you look at those providers, a couple of things to keep in mind. When you combine all those healthcare systems together, there's over 2,500 primary care providers, 5,000 specialists, 20 hospitals, and 750 clinics. So it's a very, very well-rounded healthcare system. And I think in all of the counties in our service area, they represent a common ground well and provide a lot of flexibility and access for members, not only on the small group side, but also the individual side. So let's talk a little bit about on the pharmacy network. Again, the provider network is a key to having a very strong product platform, as is the pharmacy network. So just some key pharmacies that are in there, CVS, Walmart, Walgreens, all the healthcare system also have their own pharmacies in their facilities. So Bell & Health, Theta Care, Aurora, Skywalk is affiliated with Children's. So the pharmacy network is very wide within the service area. It also expands nationally. There are also many independent pharmacies in the network. So, there are some smaller towns that might have some privately owned and run pharmacies that are in the network. Our pharmacy benefit management company is OptumRx. And if you want to, you can access the pharmacy information on our website. And as the link there, obviously I'm not going to go through that, but you can go to the website, Common Ground's website, and not only click on the 2020 pharmacy network, the larger organizations, as well as a detailed list of all of the pharmacies within the service area in the state, including the small privately run independent pharmacies. So very, very strong pharmacy network to support the small group platform going into 2021. We get asked a lot, not only on the small group side, but also on the individual side, about durable medical equipment. So in the network, there's more than 20 DME providers. Aurora Healthcare, there's Erickson, there's Bell & Health, Theta Care. Many of these are very conveniently located. Coverage is based on the benefit, not the DME provider inventory. So if there is a situation that for some reason durable medical equipment that a member is unable to get in network with the currently set up in network DME providers, we will work with that person to get them the equipment they need for their particular situation. So again, a very flexible, very wide-based, very broad DME provider network on a small group platform, not only currently, but also going into 2021 on a new platform. So let's talk a little bit about the coverage and benefits. So our plans are all ACA approved, comprehensive, qualified health insurance plans. We're going to touch a little bit about a new $15 insulin benefit. And then we're also going to cover briefly telemedicine options that are becoming increasingly more important in the current healthcare situation. So as I mentioned, our plans are ACA qualified plans. So obviously they have all the essential health benefits as part of the package, including preventive benefits. And because these are compliant, they really help to address many increasingly important health concern needs. Our plans are also SHOP eligible. So if there are any small groups that feel that they can take advantage of SHOP and the tax advantages that come with that, they can go to www.healthcare.gov and check for eligibility. If you do work with a client that is interested in SHOP or wants to go the SHOP route, as a broker, you have to be SHOP certified through the CMS, as you would if you're selling individual business, and you have to get your individual certification for 2021 for individual marketplace business. And if you want additional information on our preventive benefits, again, we have a website linked on the bottom. Again, you can go to our website, members can go to our website, prospective employers or their employees can go to our website and see a laundry list of all the preventive, many no cost, some hitting deductible in co-insurance, but that are available for men, women, adults, children, et cetera, et cetera. So one of the nice things about Common Ground is that we try to provide as much information as possible, try to be as clear as possible upfront with who we are, what we have to offer, what plans are available, and how those plans work. And so whether or not you're currently insured with us, you're just shopping, your clients or your prospective clients can check up the Common Ground website and just get a wealth of information regarding all of that detail. So let's touch a little bit about essential health benefits. Basically, there are 10 of them. So our plans do meet the ACA and Wisconsin EHB requirements. So, you know, a lot of things that many employees and employers want on plans, they're part of our plans. So preventive and wellness services, prescription drugs, hospital care, pediatric care, maternity and newborn care, laboratory services. Those are just a handful of the benefits that are in all of our plans. So when it comes to Common Ground, you know, when you look at a certificate for the small group platform, the only difference is what plan you check, what plan do you pick on the front end. You know, how does the deductible work? How does the coinsurance work? Are there any co-pays involved? But behind that, from a certificate standpoint, everyone has the same benefits available to them. Everybody has access to the same providers that are in network. So the only difference is on the front end really as to what you pick from a plan and how you want that benefit structure to be set up for your employees. So one thing new in 2021 for us is a $15 insulin benefit. As you're well aware, folks with a diabetic condition, it's a very it's a very large health situation, not only in Wisconsin, but across the country. And one of the things we found from experience is that sometimes because of the cost of the medication, people don't stay on their regimen. Maybe they don't go and get their medicine. Maybe they go without their medicine. And as we all know, that is not a good situation for those individuals to be in. So in 2021, we're adding a new $15 insulin benefit to our small group portfolio. So it's going to apply to all formulary tier 2 insulin products. So what we're going to be doing is we're going to be reducing the copay to $15 for a 30-day supply, and that's going to apply before the deductible. So as a cooperative, again, we are here to serve our members, and we want to help remove the barriers and create a sense of relief for those members in any way we can. And by adding this benefit, we believe it's going to be very well received, and it's going to help a lot of individuals who have this particular medical condition have a greater comfort level that from an affordability standpoint and an access standpoint, they're going to be able to pick up their insulin benefits on a timely and consistent basis. And this is going to apply to all of the plans except for our bronze small group plans. Let's talk a little bit about virtual care. You know, obviously, since the COVID-19 pandemic has come into our lives, your world as a broker, as an agent, has probably changed very significantly in how you interact with and contact your clients and how you prospect for business. And the same world is true for healthcare providers. So I would say with the COVID, you know, the use of telemedicine or virtual care is probably, you know, the access to it is probably sped up maybe 5, maybe 10 years because of the situation where there were a lot of facilities and doctors who were not seeing patients for non-essential or non-COVID type situations. And so a lot of the healthcare systems were pretty aggressive in finding a different way for individuals to access healthcare systems and services for their needs. So, you know, whether it's Aurora Healthcare or Bellin or Theta Care, all the big healthcare systems out there have really been aggressive in promoting the use of virtual or telehealth for individuals who are looking for care. So there's really two different types. One is kind of unscheduled, on-the-fly type visits where something comes up, you can access a website, you can access a link, and basically, you know, kind of go through what your situation is. And within a certain length of time, usually a very limited length of time, you can get some type of feedback back from that particular application as to, you know, what they think you have, what a plan of care would be, and, you know, if you need any medications to treat that situation. Another is scheduled visits. So you're kind of scheduling those visits ahead of time. Maybe it's a video conference with a primary care doc or specialist. It's generally, you know, treated from a copay standpoint in our plans, like you're going to see a primary care provider. And it's also billed very similar to as if you actually went into the doctor's office and paid him or her an office visit. So the unscheduled visits typically are going to be a little less expensive from an invoicing or a charge standpoint than the scheduled visits. But again, they've come a long way, especially so far in 2020 here, to help accommodate individuals to access health insurance services when, because of the COVID-19 situation, a lot of normal visits to a doctor or facility have been put on hold. And so one of the things we're going to talk about with Common Ground is virtual. So in all of our plans, not only our small group plans, but our individual plans, we have a benefit called virtual. Katie, you want to advance that slide? Okay. So I would say a lot of you are aware that virtual is part of our programs. Maybe you're not. So it's available on all plans that Common Ground has currently. That's on the small group side as well as the individual. So basically, it doesn't replace a primary care visit or specialist visit. It doesn't replace urgent care or emergency care. But if someone has a situation where, boy, they have concerns, they want to bounce off a medical professional, maybe it's in the evening, maybe it's on the weekend, maybe they're traveling, and it just isn't a favorable situation for them to get in quick and see somebody, they can go online to virtual.com. So they can use their smartphone, they can use a tablet, they can use a computer, they can use a laptop. So they just go to virtual.com. It's a 24/7 online clinic. It's kind of like going to a doctor's office. You go in there, they've got a listing of general categories. You pick one that you think applies most to your particular situation. They run you through a series of questions, ask you if you're allergic to any medications or anything else. And then you kind of fill out a questionnaire and you submit that. They may even come back and ask you, hey, if you got a photo of something that you can take and tag it on there, send it to us also. So after you submit it, within 30 minutes, you're going to get a reply back from a board certified nurse practitioner. And they are going to tell you what they think you have, what the plan of care should be. If you need any medications wired over to Walgreens or CVS, they'll take care of that for you. So it's a very convenient, flexible, and inexpensive way to get care at a moment's notice. So the first 10 visits in a calendar year for everyone insured on a plan is free. The only exception would be if they have an HSA compatible plan. If that's the case, then that e-visit, as we call it, is $49 per e-visit. But again, a very inexpensive, flexible, convenient way for individuals to have their healthcare situation addressed by a medical professional. And the other thing we'll touch on really quick is almost all of the major healthcare providers now, whether it's Aurora, Bell, and Theta Care, they have their own personalized healthcare system apps. My primary care and specialist docs are part of Aurora. So the LiveWell app is something that I'm familiar with. And what's great about it is it's something that you can go to the App Store or to Google Play. You can download it onto your smartphone. It lets you set up virtual visit options, lets you find providers, check in for urgent care, find locations, find out if there's any quick care available in the area. And a lot of other information is available at your fingertips to help individuals get in contact with a healthcare system, your doctor, set up appointments, pay bills, get wellness tips, et cetera, et cetera. So Common Ground obviously has a member services area and a sales team. We have the virtual app, but all the key healthcare systems in the Envision network also have their own proprietary way that individuals who are seeking care with one of their providers or facilities can quickly get information and access at the earliest convenience. So a lot of things have really come pretty far here in 2020 when it comes to the virtual televisits and also technology when it comes to apps to access healthcare services. The other thing to be aware of from Common Ground for small group employees is the Common Ground mobile app. And so we've kind of refreshed that here for coming up for 2021. And again, they would just the App Store or Google Play, type in Common Ground Healthcare. They download that up, they set it up. They can make one-time payments. They can access all of their plan information and materials right at their fingertips. And it also gives them links to general information that's on the main website for Common Ground. Things such as the pharmacy, the formulary, provider directory, and much more. So very easy to set up. They just enter their first name, their last name, their date of birth, and their social. We've got them in the system. They get set up. Again, something that's very flexible, convenient, at their fingertips to access their benefits, their plan, and services from Common Ground and the provider network. And the last thing I'll touch on is advertising. So we've got a pretty aggressive advertising campaign to kick off the sponsor group relaunch for 2021. So currently, Gabby Davis, who's our head of marketing, she set up paid search and targeting social media initiatives. So that information is already out there. And it's really starting to promote, obviously, Common Ground and a new product launch that we're having coming up here in 2021. We're also going to do a pretty substantial direct mail campaign to eligible small groups throughout the service area. So the first drop will be, I think, shortly after Labor Day in early September. And then as we get set for being able to actually provide quotes for the small group plans for 2021, we'll do our second drop. So the other thing we're going to be doing is that any other type of advertising that we do, whether it's banners or billboards, we are going to note on those advertisements that Common Group does have small group plans available for employers. So the picture on the screen basically is kind of what that first postcard is going to look like. Obviously, again, directed to the small business community. Talks a little bit about who Common Ground is, the number of plans we have, and if they want any additional information, we ask them to call their insurance broker, which is you. Hopefully you get a lot of calls from either existing clients or prospects that are interested in getting information. Call the toll-free number, and we can address their needs that way. So we're putting a lot of resource into the marketing campaign to get the small group program in a new direction for 2021. And we just wanted to make you aware of some of the things that we are doing to help support that cause. So I think the next slide, we're going to have April start up with going over the in-service area plans.
Yep. Thank you, Jim. All right. So we are going to talk about the in-service area plans. We are going to have 19 plan options with flexible plan selection in the 22 county service area. And as Jim had mentioned, 2 additional counties will be coming in for 2021. And again, that's going to be Green Lake and Florence. So we are going to have 2 platinum plans. For the individual deductible, it's going to be $500 and then twice for family. The maximum out-of-pocket for the individual is going to be $1,500 and then again twice that for family. The coinsurance is going to be 10 or 20%. The PCP copay, $25, and then double that for the specialist. So the RX copays will range from $10 to $70, and that's going to be for Tier 1 through Tier 3. The specialty drugs will apply to the deductible and coinsurance. So for the gold, we are going to have 6 plans. The deductible is going to range for the individual from $800 to $2,750, twice that for the family. For the individual max out of pocket, it's going to range from $6,000 to $8,550, and again, double that for family. The coinsurance will be 20% on all of the plans. And the PCP copay will be either $30 or $35, and the specialist copay $60 or $75. The RX copay will range from $15 to $80, and that's going to be for tier 1 through 3, with again the specialty drugs applied to the deductible and coinsurance. And then for the silver, we are going to offer 6 plans. The individual deductible will range from $3,000 to $6,000, double that for family. The individual max out of pocket will range from $4,500 to $8,550, double for the family. The coinsurance will either be 0 or 20%, and then the PCP copay will either be $40 or $70, with the specialist being $80 or $120. The RX copays will range from $25 to $100, and again, that's going to be from tier 1 through 3, with the specialty drugs applying to the deductible. So for the bronze, we're going to offer 4 plans. The individual deductible will range from $5,500 to $8,550, twice that for family. Individual max out of pocket, the $7,000 through $8,550, and again, twice that for the family. Coinsurance will range from 0% to $40, with the PCP copay either being $35 or $75. Specialist copay will be $150. Tier 1 through 3, medication will apply to the deductible coinsurance, as will the specialty drugs. All right, so the out of service area coverage. So this is going to be for the employees who select an in-service plan, but they experience a need to see urgent care or go to the emergency room. We will allow the members to access First Health only in these situations, but utilizing the First Health network will protect the member from balance billing. All right, so the bordering county options, they are going to have 2 options. And if you look at the map on the blue, those would be the bordering counties. So if they would select an in-service area plan, they will have cheaper premium, but they would have to utilize coverage or providers in the 22 county service area. If they choose an out-of-service area plan, it will be more expensive, and they do have to utilize the First Health network. So the out-of-service area plans, we are going to offer 2 gold, 2 silver, 2 bronze, and these have been matched to comparable in-service plans, and these are required to be selected at initial enrollment. Okay, so the first, I think you missed one, Katie. Katie, could you go back to the out-of-service area plans? The one right before that. Yep, thank you. So the out-of-service area plans, we will have 6 plan options, the gold, the silver, bronze, utilizing the First Health network. And then this again is the 2 gold, 2 silver, and 2 bronze that were matched comparable to the in-service plans. So the First Health Network, this would be the network for the out-of-service area plans in order to not be balance billed. It's one of the largest provider networks in the country, and it contracts in all 50 states. So the plan selection options all depend on the size of the group. If the group has 2 to 4 employees, they can choose one service area plan, 5 to 19 employees, 2 in service, 1 out of service, and 20 to 50 employees, 3 in service and 1 out. So the general eligibility, the employer must be located in the 22 county service area. The employer size is 2 to 50, including part-time employees. The full-time employees must work at least 30 hours a week, and the employer is required to contribute at least 50% of the employee's monthly premium, but is not, is not required to contribute to the spouse or the dependent. And at least 80% of applying employees must reside in the service area. And then the grid at the bottom left, the number of eligible employees is on the left, and then the number of subscribers that are required for participation. Okay, for the small group quoting. So this is an option in the broker portal. And what you would do is hover over the small group quote and run the quote. You can save it or email it to the group. And I know a lot of the agents, a lot of you send quote requests to quotes@commongroundhealthcare.org. You can still do that. Make sure that the name and the zip code, county of the business, they request an effective date, the total number of employees, if they're full or part-time, date of birth of all of the employees, their spouse, and dependents. Indicate that all in the quote. If you do have out-of-service area employees, make sure to include the zip code, county, and state of any of those employees. So if you are going to submit a group for coverage, we do need the completed, signed, and dated employer applications, along with the employee applications and waivers. The Section 111 form, this will be found on our website. Include a copy of the sold quote and a current wage and tax, along with the binder premium. So we do need all these requirements submitted by the 10th of the month prior to the effective date of coverage. And the contact information for sales, we've got Megan Enerson is also an account executive, as is Jim Wood. Myself, I'm a broker service specialist. And we do have a newly hired broker service specialist. Her name is Heidi Heitschatz, and also a new sales director, Deb Trinan. So we are all here to help. I know a lot of you call the broker line, which is listed at the bottom, the sales mailbox as well. If you want to just shoot an email to us with a question, feel free to use that mailbox, sales@commongroundhealthcare.org, and we can help you out. All right, and then if you could keep your microphone on mute and then submit questions in the chat box, we will be responding to those.
Yeah, so it looks like we have 2 questions so far. We will allow a little bit more time if you do have a question that comes up. Starting with the first question, it is, when are the rebate checks going out for those members who, the individual members who had coverage in 2019?
Well, this is Jim. I'm not aware of the exact date. Are you, April, on those?
I am not, but I do know that last year they were all sent out by September 30th. So they
Yeah.
should be hearing something in a few weeks.
Yeah, I believe they are sending something out shortly. And yeah, like you said, last year they were required by the ACA to send them out by September 30th. So we're kind of anticipating that it's going to be the same thing for this year. But like we said, we will send something out. We'll probably send out an email to all the brokers to let you know that that's coming up also. So the other question that we had then is, will the slides be shared? Or will they be sent out to all the brokers?
Yes, I think that came from Wanda. Yes, Wanda, we had two broker webinars on the sponsor group relaunch, one last Wednesday and one obviously this afternoon. So what Katie will be doing is that she'll be putting together this PowerPoint, and we're going to be adding an appendix to the back of it with some additional detail on the plans and also a Q&A. So once that's all put together, what we're going to do is package it, send it out to all the brokers. And then obviously, as April said, if you have any questions, if you want additional information, just give us a call, shoot us an email. Obviously, we'll also let you know once we are available to start actually quoting for 1/1 effective dates. And I would anticipate that that's when the activity is really going to start picking up the pace and more questions might come up, especially because of the way that, we have the platform set up with not only in-service area plans for out-of-service area plans. So if you have any existing clients that have employees, let's say both in, let's say the Milwaukee area and maybe somebody in Madison or somebody in Gurnee, Illinois, that out-of-service area plan situation comes into play. So we'll definitely work with you as to, how to properly run that on an illustration standpoint and also explain it to the employers and the employees. So yeah, we will be getting this and additional information out to you here shortly.
Okay, so it looks like we had another question come in from Jenna. It's, are the networks and counties going to be the same in 2021 for both individual and small group? And then is there more information on individual plans that are coming out?
Do you want to answer that, April?
The counties are going to be the same, yes. And there will be additional information for the individual. I believe it's going to be the end of September that we are going to have a webinar for that as well.
Yeah, right now from, usually when it comes time for open enrollment on the individual side for the ACA, we usually do 5 or 6 actual update meetings out in the field, anywhere from Milwaukee to Green Bay to Oshkosh. And obviously this year with the COVID situation, we're going to step back from the live presentations and do webinars. So right now, a couple of times in the past, we've been asked if we can kind of move the dates up from when we do the webinars, because, we're heading into the height of the selling season for you. And it's not only the individual products, but it might be small group renewals. It might be Medicare. So you've got a lot of things bouncing around. So we're tentatively planning now to do 4 webinars. And right now we're looking at September 23rd and September 24th, 1 in the morning, 1 in the afternoon. As we get this thing dialed in closer, obviously we'll set up an update and wait for you to RSVP, and we'll do the webinar format again. But we're moving it up about 2 weeks. So hopefully from a scheduling standpoint, that'll help a lot of you that have just a lot of competing demands going on for your time as we get into the, start of the 4th quarter. So that's kind of where we're at right now on the updates for the 2021 plans. I mean, obviously we have the plans already packaged up and we've got the rates filed. It's just a matter of introducing all that detail as well as some other things I think you'll be pleased to hear from us coming up for the 2021 open enrollment.
Thanks, Jim. So yeah, it looks like that's all the questions we have. If you guys do have any additional questions that come up, even when we send out the PDF of the PowerPoint, feel free to use this contact information slide and reach out to any one of the broker service specialists or account executives, or call that broker hotline that we have. And yeah, we just want to thank you for joining us today, and we look forward to seeing you again when we have the individual plan webinar.
Okay, thank you, everyone. Thanks, Katie.